29-year-old female presents to my office with a chief complaint of pain involving the lateral aspect of the right knee. No traumatic event, no change in activity. Evaluated the knee, there was a slight effusion, limited range of motion from 0 to about 90 degrees. There was definitely lateral joint line tenderness. I was concerned about a potential lateral meniscal tear. So I went ahead and obtained an MRI scan of the knee. I want you to look at it and tell me what your differential is when you look at these images. The first image you're going to look at is a coronal view of the knee, and I'm scrolling through the knee joint. And this is a T2 image, and you can see this is the lateral side of the knee, this is medial, and there's very abnormal findings involving the lateral femoral condyle. I'm going to scroll through here slowly, and I'm going to go back through here again. You can see this is the normal bone, the medial side, and the tibia looks completely normal, but this area is very abnormal in appearance. I'm going to go ahead and show you some sagittal views now. This is a side view, more like a lateral view, and you can see on the medial side the knee looks normal, the bone looks normal. Here is the PCL, so we're crossing over into the lateral joint side, and you can see how the bone is very, very abnormal in appearance, especially in this area right here. The differential on this patient would be a giant cell tumor versus a aneurysmal bone cyst. Typically with an ABC or aneurysmal bone cyst, it's a younger age group, and you can see fluid-filled areas that almost look like a cup with fluid in it, where this patient's not quite looking like this. To me, this looks like a giant cell tumor. So what do? What happens when this MRI scan comes across you in your office when you're seeing your patient? The first thing you're going to want to do is refer this patient to an orthopedic oncologist. They will need a biopsy that will need to be done to confirm what the soft tissue diagnosis is or what the bone tumor is, and then treatment. I believe this is probably a giant cell tumor. Most likely the orthopedic oncologist will need to go in there and remove all that tumor. Sometimes they'll put phenol in that area, even cryotherapy, so it doesn't compact, and then pack it full with bone graft. This is a benign tumor, but very aggressive. There's a 2 to 5% incidence of metastatic disease to the lungs, and sometimes it comes back up to 10%.